Yvonne Greer here with Karyn Palmer on location at Heddington Oaks. Karyn's the director of nursing, and the last time we were here chatting, you were talking about the transition process to go from hospital to here at Heddington Oaks, whether someone's had a stroke or a fall but is in need of rehabilitative care.
Yes.
Now we're going to talk about how the process goes that they get that rehabilitative care and are able to transition back to home.
Yes.
So catch me up if you would. There were two types of therapies that you provide here?
Mm-hmm. We have three. We have physical therapy, we have occupational therapy, we have speech therapy.
And the distinctions amongst those three?
Physical works with your large muscles, so legs and arms. Occupational is more fine motor skills and getting dressed, activities of daily living. And speech, especially with the stroke patients, helps them regain their swallow.
Okay. So how do you know as a practitioner when the patient is ready to go back home?
So therapy continually assesses the patient, and so when they've determined that that resident has progressed far enough that they're safe to go home, we set up discharge for them. About 90% of our residents go home with home health services, so that it would include further therapy in the home.
Okay.
A nurse that comes out to see them and check on them regularly, do any teaching that needs to be done, monitoring their health condition. They're also qualified for some CNA help if they need it to help with bathing. They can come out a couple times a week and help with that until they're strong enough to do that safely on their own. So it's a way that we make sure that they are going home but they remain safe and they continue their education and their recovery, all to prevent rehospitalization.
That's terrific. So where's that fine line of distinction between I've met my physical therapy requirements and I'm ready to go home and I'm going home and I still need that continuing care? Does it depend patient to patient?
Yes, it varies patient to patient. Most patients generally will benefit at least for a little bit, at least a few weeks of home health, just to make sure that transition is safe, that they're safe in their home, they're functioning in their home, they're getting the care that they need, and that they can take care of themselves at home independently before they are discharged just to the care of their primary care physician.
And many times folks come into your care here at Heddington Oaks not prepared for whatever the event was that brought them here, whether
Correct.
it be a stroke or a heart attack or a fall. What types of things can you say to encourage people to let them know that it's going to be okay?
We just continue to work with them, explain the process, educate them on their disease process, especially with a stroke. That's a particular situation that you continue to recover from even after you leave our services. So just reassuring them that they will continue to get better, and explaining the process that, progress comes in stages. So you'll take a jump and then you'll kind of plateau for a little while and then grow some more. Encouraging them to continue their outpatient therapy so that they continue to get stronger, and encourage them to come back to us if they find out that they're going home and it's not going as easy. They're always able to come back to us to continue their therapy and get some more strengthening here if things don't turn out while going home.
I understand. And are there processes for the caregivers at home once they leave here? Because sometimes it's, my husband has had the stroke, or my dad, or my older brother or sister.
Yes, part of what we do is educating the family while the residents are here so that they feel comfortable to take care of their loved one at home. We answer any of their questions. They can always call us if they have questions or concerns, and usually the process, if they feel like that resident needs to come back, it's a simple phone call conversation with the doctor to get orders to send them back here.
And I would imagine their level of comfort and ability to care for their loved one when they do come home will determine how much care you're also going to provide at home as well.
Absolutely.
Terrific stuff.
All right.
Karyn, thank you so much for being
you.
with us here in Living Well. We appreciate all your efforts here at Heddington Oaks. And thank you for watching as well.